So welcome, Kathy.
Thank you.
So what I'd like to know is why you're here. What would you like to work with today?
Well, today I'd like to work on some knee issue that I'm having, primarily in my right knee, but sometimes in my left. About 10 years ago, I jumped from about here to here and twisted as I did it, and something popped in that little area right there on my knee.
Okay.
And over the years, it's kind of caused me problems. And then about 5 years ago, I was diagnosed with an autoimmune connective tissue thing. It's a pretty obscure one. So about 10 years, here we are 10 years later, how it expresses itself in my body, because I sit pretty much most of the day.
Right.
I think my take on this is these muscles are shortened because I get a lot of tightness right here.
Yes.
And whatever connects at that place, I think there's 3 or 4 muscles that connect there, they get really tight, and I think they pull on it. And my hips start to hurt, my knee gets to where I can almost not walk, so I have to stop and try to do some stretching, which sometimes will alleviate it, sometimes it won't. So what I'm interested in is what I can do for exercises or some kind of yoga postures that will help straighten me out. Exaggerated posture of mine is kind of twisted.
Yeah, I'll have a look at that.
So
okay. So at the time of that accident, did you go to a healthcare practitioner?
No.
Okay.
No, I just powered through.
Okay, right. And the symptoms started to show up. And you said that it's now moved into the lower back.
I have a lot of pain in my lower back, particularly in the morning. All the issues are more pronounced in the morning.
Yes.
So yeah, the lower back thing is new.
Okay. Do you feel like it's related to the knee or more to the connective tissue?
No, actually I don't. I just feel like my lower back is locked in the morning. And I think it feels like connective tissue to me.
Yes.
Yeah, so.
All right. And you say that you have a healthier lifestyle and that yoga is a part of that healthier lifestyle. What in particular in a yoga class are you finding feels good to you or doesn't feel good to you?
What feels good, what helps more in terms of my knee issue is anything I do to stretch my psoas and to stretch these muscles in the front. I also am I'm very flexible, so I'm very fond of forward bends. They feel so good. I love down dog. I also like twists. They seem to make my lower back feel better. What's hard to do is any kind of postures where I'm standing on one leg or the other. I think it's good for me, and I try to practice them gently at home just to develop all those little muscles. But it's hard because sometimes that really stresses this place on my leg, which is my vulnerable place.
Yes.
Yeah.
So when you do standing on one leg, those postures, it's in the knee that you feel it? Okay, not in the hips.
As I'm trying to balance, it's that place right there. It's just like it's a pinpoint.
Okay, all right.
And I feel like if I don't move fast, it's going to pop or something.
Right. Okay. So what I'm going to do with this information, I'm going to have a look at your posture and see in yoga therapy, what we try to do is look at the posture to see not only what could have set you up for this vulnerability in the knee, do you follow me? Or, in your case, what might have developed because of the injury now 10 years later, right? So all kinds, the body tends to adapt and compensate beautifully, but when it does that and it tries to take responsibility out of the area where the injury has been, it tends to then set up sort of a pattern somewhere else. So we're just going to be seeing kind of what your body's up to after this injury, see what we can find. So this is kind of an exploration, all right?
Okay.
All right, great. So if you'll stand here, you know the pose Tadasana, so stand facing, yes, that way. Okay, and do these pull up to see the knees? If not, it's okay. Is it okay if I touch your knees?
Of course it is.
Okay, great. All right, so I'll be saying a few things about what I'm seeing. On this side, one thing that I'm seeing is this foot is liking to supinate, And because it is, the toes are kind of grabbing to keep the foot grounded. Does that make sense?
What's supinate? That way or that
yes,
way? That way.
That way. And so as the foot supinates, your toes are responding by doing that, like, oh, 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 oh.
To keep me from going, okay.
Yes. So that tends to cause weight bearing more here, and your injury to the knee was here. So your foot is taking responsibility out of the medial line and putting it in the lateral line. Does that make sense? Okay. All right. There's a slight bit of supination here, but basically this is the foot with the story. See how these toes are more relaxed? And these are creased, so they're pulling up.
Oh, I forgot one more thing.
Yes.
This ankle was, everything that I have problems with is this side.
Right.
I sprained the ankle really badly by falling on it like that with my full body.
Okay, well there we go. Well, you see, that a supination creates that sort of overstretching here and a tightening here, so that's kind of part and parcel of what might happen. Okay, I'm just going to look at you from the side here. And your knees like to hyperextend. Did you know that? Okay.
Everything does, unfortunately.
Yes. And so what that means is that you really are depending on your ligaments to stop the movement of the knee going all the way back. And so that's going to immediately put a vulnerability around the knee, just the hyperextending. So one thing I'm going to ask you to do as you stand here is tell me what part of your feet that you sense are the most weight-bearing. Can you sense that a little bit?
The heels.
Okay.
The outer, that part of the heels.
That's good. So that's a classic for supination because the inner heels tend to come away from the floor in a supinated foot, and so we want to think more about letting the inner, that's it, the inner heel come down. Now, the next thing I want you to do is lift all your toes up, good, and sort of spread them out. Maybe take your heels a little bit wider apart than that. There you go. Good, right there. Keep the toes lifted, and I want you to really take some responsibility, not so much of weight bearing through the front of the foot, but more a sense of you're actively rooting through this whole, all of these toe mounds from the base of the big toe, particularly the base of the big toe and the base of the little toe. Now as you do that, can you let the top of the tibia, that's the lower leg bone, travel slightly forward until you have a sort of a micro bend in the knees? Can you feel that a little bit? And then relax your feet and let the knee go back to where it was. Can you feel the difference? So the bottom of the patella gets very deep when you take this action out of the foot. This part of the foot, these muscles here, Kathy, are totally connected up into the back of the knee.
So is that why my arch frequently hurts and like cramps?
Yes, yes, because your toes are showing it how hard they're working, these muscles are working because the knees are pulling you back into the outer heel so much. Yeah? So what I'm asking you to do is lift the toes, take the feet or the rooting into the front of the feet, and actually let's step you up on these blocks to do this.
Like this?
Mm-hmm. Can you feel how that just gives you a little bit more distinct sense of your feet? Good. Now, are those two, they may be two, bring the feet a little bit forward. There, try that. Make sure the base of the toe mounds are all on the block. Good. Now, I think this will work for you better. You sense how you get a little bit more feeling there for the...
It's interesting that my right little toe mound just doesn't want to touch.
Yes, and here's why. That outer arch of the foot that runs from the base of the toe, little toe, to the front of the outer heel. When you supinate as much as you've been doing and take your weight into the outer edge of the foot, you no longer have that outer arch. And that outer arch is really, really important regarding what's happening into your knee joint. So we're going to focus on giving you back an outer arch in your feet, and that's part of what we're doing here. So the toes lift and they spread. Base of the big toes are down, but the base of the little toes, as they press, you want to see that your little toes wing out to the side, and this part of the foot becomes very, very active, like a little arch from here to here. You feel that? That's really what you want to feel. And then you keep that until you feel the knees come into a very slight microbend. You feel that a little bit? Good. And then relax the toes and let's step down off the block. Good. So that's piece number one, right?